A common concern among my clients is that they owe the hospital or the pathology or the labs or their doctor a bill, and they are afraid that they're not going to be able to receive medical service in the future if they discharge those debts. When it comes to medical debts, it's important to keep in mind there are two categories of those. The first we call the provider debts. The actual hospital bill is in that class. People who provide medical services for you, lab work, radiology, anesthesiology, and other services cannot be denied to you in the future if you discharge those debts. If you show back up at the hospital and have discharged debts to them, they will treat you. You will have your x-rays taken and your blood will be sent to the laboratory. If you owe a personal doctor or your dentist a bill and you discharge that debt, they do not have to continue treating you. Before you do that, if this doctor is important to you, we suggest you go to his office and talk to someone in his office about the fact that you are filing a bankruptcy and will that affect your treatment. If this will affect your treatment, you can voluntarily pay that debt during or after your bankruptcy case. One of the principles of bankruptcy is that you are allowed to repay any of your past debts. If you wish to continue repaying your doctor in order to continue your treatment, that's fine. However, if your doctor demands payment of this on certain terms or certain schedules, we need to talk about whether or not you should consider keeping that debt. Whether or not you keep a debt owed to a medical provider or a doctor is an important consideration, and you should not make that decision absent contacting us and obtaining a consultation.